Measles is a highly contagious viral infection caused by the measles virus. The causative organism of measles is the measles virus, which belongs to the Paramyxoviridae family. The incubation period of measles, which is the time between exposure to the virus and the onset of symptoms, typically ranges from 7 to 14 days, with an average of around 10 days. Measles is primarily transmitted through respiratory droplets when an infected person coughs or sneezes. These droplets can remain in the air for some time or land on surfaces where the virus can survive for several hours. Direct contact with respiratory secretions or contaminated surfaces can lead to transmission of the virus to susceptible individuals. The clinical features of measles typically progress through several stages. Prodromal stage. This stage begins with symptoms resembling a cold or flu, including fever, cough, runny nose, sore throat, and red, watery eyes. This stage lasts for about 2 to 4 days. Koplik spots, small white spots with bluish-white centers on a red background, may appear inside the mouth on the inner lining of the cheeks opposite the molars. These spots are characteristic, but not always. Rash stage. A red, blotchy rash typically appears about 3 to 5 days after the onset of symptoms. It usually starts on the face and then spreads downward to the trunk and extremities over several days. The rash typically lasts for about 5 to 7 days. The management of measles typically involves supportive care to alleviate symptoms and prevent complications. Here's a breakdown. Point 1. Rest. Patients with measles should get plenty of rest to help their bodies fight the infection. 2. Hydration. Encourage adequate fluid intake to prevent dehydration, especially if there's a fever. 3. Fever reduction. Fever-reducing medications, such as acetaminophen Tylenol, can help make the patient more comfortable. Avoid aspirin in children due to the risk of Ray's syndrome. 4. Nutrition. Ensure the patient is eating a balanced diet to support their immune system. 5. Isolation. Measles is highly contagious, so infected individuals should be isolated to prevent further spread. This includes staying home from school or work until they are no longer contagious. 6. Vitamin A. In areas where vitamin A deficiency is common, or for individuals with severe measles, vitamin A supplementation may be recommended to reduce the risk of complications and death. 7. Monitoring for complications. Keep a close eye on symptoms and seek medical attention if complications, such as pneumonia or encephalitis, develop. 8. Vaccination. While not a treatment for current infection, vaccination is the most effective way to prevent measles and its complications. Ensure that eligible individuals are up to date with their measles vaccination.